Hi everyone, for those that don't know me, my name is Emma Moroney and I'm a case manager here at the hospital. My job is to support those with chronic conditions in tackling self-management. I'm here to talk to you today about interdisciplinary teams and what they can do for self-management of chronic conditions. Specifically, I want to discuss a client by the name of Jo, who you are all familiar with as you are each either a support worker or a health professional involved in her life. To start off with, I would like to discuss with you the impact of stroke on a person such as Jo. As described by Stroke Recovery Association New South Wales, physical symptoms of stroke can include paralysis, poor coordination, loss of feeling, lack of awareness, neglect of one side of the body, difficulty initiating movements, difficulty planning a sequence of movements. All of these symptoms have affected Jo in one way or another, and it is our job to help combat these disabilities and enable Jo to achieve everything that she sets out to do in a day. Jo experienced a right-sided parietal infarct, which has evidently resulted in a left-sided hemiplegia. This includes Jo experiencing intense sensitivity on her left side, so much so that causes her great pain. She also has very little strength and functioning on that side of the body. This is known as left neglect. As a result of the stroke, Jo has also acquired a brain injury in the process, and she describes this as having a brain like a baby. This can mean that simple tasks such as getting dressed, making her bed, or decision-making can be extremely difficult for her. Jo has mentioned that she wishes to stay as independent as possible, and this requires our patience on our behalf. It now takes Jo a lot longer to process and complete simple tasks in her life, as she must plan out everything she is going to do before she does it. And even when completing the tasks, it requires great concentration. The impact of a stroke can affect an individual in many ways, not just physically. The physical effects can impact on the individual's self-consciousness, mood, as well as irritability. People affected by stroke are now having to live with the fact that they are unable to do certain tasks independently, such as showering, clothing, making a bed, etc. And this can be quite frustrating and disheartening. This can potentially result in feelings of depression and defeat, as they must learn a new way of life with a significant loss of privacy and independence. The impact of stroke lessens the opportunity of socialization, as they must thoroughly organise the event and spend much more money than they used to on simple leisurely activities such as catching up with friends. With Jo, for example, her social interactions have decreased significantly, as she must now organise and pay for a taxi fare as she can no longer drive. This is often not even an option, as she puts majority of her money towards carers and specialist appointments rather than unnecessary taxi fees. The World Health Organization defines quality of life as individuals' perception of their position in life. This can mean that for stroke patients, their quality of life rating may be significantly low, as they are now having to deal with being less independent, and this can cause feelings of frustration, sadness, and anger. Physical effects of the stroke can impact quality of life, as the individual is unable to complete simple daily tasks independently anymore. Therefore, we need to implement a good strategy to focus on Jo's self-management for her to gain some independence back into her life. To do this, we need to change our structure of care to a team-based structure. There are many ways to approach this, but I will be telling you about two methods of team structure in the healthcare system: an interdisciplinary team and a multidisciplinary team. Interdisciplinary teams rely on client-centered approach, as they consult with the client collaboratively and discuss potential outcomes of treatment plans together. Whereas multidisciplinary teams include a different approach to assessing the client, as each discipline will meet with the client separately, discuss their ideas with the client exclusively, only then suggestions are discussed in a separate meeting, not including the client. Therefore, the interdisciplinary team approach is better suited for the goal of achieving self-management of chronic conditions, as it is client-centered and involves all disciplines equally. A collaborative approach works best when the client wants and needs are heard by the whole team. Collaborative interprofessional practice is what we are aiming to supply for Jo in her life after experiencing a stroke. This means that we form a collaborative partnership between a team of numerous different healthcare providers that are involved with Jo, and with this we work together to reach a common goal of assisting the client and their needs. This is achieved through independent collaboration and the client of independent collaboration, sharing information with the team openly, and using this combined information to make a shared decision. The goal of the interprofessional team is to aid the client in self-management of the chronic condition they are experiencing. Self-management can be defined as managing symptoms, treatment, physical consequences, and lifestyle changes independently. For self-management to occur, collaborative assistance via the interprofessional team needs to happen. This requires an approach where communication between each discipline needs to be open for all in the team environment, for everyone to have a better understanding of the progress of the client. Jo has expressed that she is frustrated with the way in which her care plan is set out, and that the communication regarding this is not satisfactory. In order to turn this around and assist Jo with ensuring she can self-manage her chronic condition, an interdisciplinary approach will be successful. In doing this, she will be able to discuss care options for her openly, with Jo as the centre of the conversation. With everyone's ideas on the table as well as Jo's, we can all be on the same page when discussing treatment and care options. In Jo's case, she is working to gain her independence back as much as possible. This is where the interprofessional team can assist Jo collaboratively, helping her to work towards her goals and setting a plan to ensure this happens, as well as listening to her thoughts and opinions. An interdisciplinary team approach will only be successful if all practitioners are working collaboratively, sharing equally, and having a positive attitude towards the goal. I understand it can at times be difficult to have a client-centered approach to care when the client has recently experienced a brain injury. However, it is important that all members of the team remain positive throughout intervention. Self-management approaches are intended to allow the client to take control over their health and well-being needs. The attitude of the interdisciplinary team can affect this and the way in which the client believes they are engaged and feel supported in their self-management journey. Self-management programs can often be seen by health professionals in the team as difficult tasks when the cognitive abilities of the client are impaired. Brain injury following a stroke can often lead to cognitive complications such as impaired decision-making skills based on memory and emotion. This can make it quite difficult for health practitioners to allow the client to make the best decision related to their health needs. The practitioners, therefore, can sometimes be seen to guide the client into deciding, which may not be in the best interest of the client. Self-management for stroke patients can be highly beneficial in recovery. For Jo, this would benefit her in many ways, as she would be able to make her problems and issues heard amongst the interdisciplinary team. Jo had expressed that she has been feeling like she has been treated like a second-class citizen in terms of her care and self-management. This can be addressed in the approach to assist Jo in achieving self-management of her chronic condition. Allowing Jo time to think about a decision can give her the opportunity to be actively involved in the team and decisions made. Some strategies and interventions we can implement as a team to increase Jo's self-management and independence include things like motivational interviewing, incorporating the COOP approach, as well as occupational therapy interventions such as medial and compensatory methods. Motivational interviewing can be a great technique for post-stroke patients. It can improve mood as well as build confidence and help them adjust and adapt to change in lifestyle, including making realistic goals. This could assist people like Jo in making her feel like she's being treated with respect and like a real human being, as well as assisting her to set realistic goals that she can achieve, only enhancing her confidence and self-esteem. The COOP approach is another good self-management intervention strategy that stands for Cognitive Orientation of Occupational Performance. Through this, we work with the client post-stroke with achieving their goals through a client-focused intervention strategy. Through a client-based strategies, such as the COOP method, this can empower people like Jo to reach their goals as they are set out to be achievable in the eyes of the client. Occupational therapy interventions such as a remedial and compensatory approaches to self-management are another great techniques for increasing self-management abilities and independence. A remedial approach encompasses training of specific cognitive problems after stroke, using things such as pencil and paper, computer tasks, and board games to train the cognitive abilities lost after stroke. This can assist Jo in that she can enhance her own cognitive abilities such as memory, emotion, and decision-making skills. In doing this, Jo is better able to take control over the decisions being made regarding her care after stroke. This can empower people like Jo in that they are able to have more control and independence over their life and able to take back basic functions that they were not able to do after the stroke. The compensatory approach, however, consists of a few different methods of self-management, including practicing and learning how to complete daily activities again, such as dressing, driving, and cooking. Second one is educating the client on assistive devices such as an alarm watch or medication organizer. And the third, educating all those directly involved with the client's daily life about the strategies to overcome or improve their cognitive impairment. Strategies such as these can assist people like Jo in teaching them ways to live as independently as they can. Simple things such as learning how to dress herself again would be highly beneficial for Jo's quality of life, as she is one step closer to being even more independent. Ongoing strategies to improve or compensate for cognitive abilities can enhance Jo's confidence and independence, as she will be constantly learning how to adapt herself to her new life. I hope that each of you have taken something out of today's personal development meeting, and I believe that we can look towards supporting people like Jo with a collaborative approach to self-management in the future. Thank you.